So it's my pleasure to introduce John Diaz Decaro today. John is a doctoral student in the EHS program and is currently working at LA County Public Health Lab. So his project is under the supervision of Nicole Green, who's the director there, and is an adjunct faculty member in our department. And prior to coming here to UCLA, he worked at Siemens as a quality control microbiologist and manager in their healthcare diagnostics division, and also got his master's degree at USC in experimental and molecular pathology. And since being here, he's also taught at Cal State Dominguez Hills. So the equivalent of like our EHS 100 class, right?
Yeah.
So anyway, he's done tons of stuff. He's going to tell you about one of his projects with Nikki today, looking at the public health impact of the Disneyland measles outbreak. John.
All right. So thank you, Hillary. So as you said, my name is John Diaz Decaro, and I'm a doctoral student here, and I've been here a little too long. But today we're going to be talking about the public health impact of the Disneyland measles outbreak that happened at the end of 2014, early 2015. I'm going to give you a general overview of what measles is, what we know about measles, a little bit about the epidemiology. I'll talk about the MMR vaccine, and then I'll delve into the Disneyland outbreak, and then talk about a little bit about what we did in the lab, a law that was passed as a result of the outbreak, and some of the costs associated with it. So I'd like you to just close your eyes and pretend you're at Disney.
How about taking a trip through Disneyland?
You mean it?
Sure. Come on. Once you step through Disneyland's main gates, you find yourself in the happiest place on earth.
I think Mickey wants us to take everyone to Main Street.
Excellent idea.
The video goes on for another 14 minutes, so I don't want to take up that time to watch the video, but I do want to give you some fun facts about Disney. Did you know that all of the plants in Tomorrowland are edible? So you can eat all of those plants. Every year, about 2.8 million churros are eaten at Disneyland. There's a rumor among the employees that there is a basketball court inside the Matterhorn. The Haunted Mansion has 999 ghosts in it. Club 33, which is found in New Orleans Square, is the only place in Disneyland where you can buy alcohol. I can see you all running that down. And also, this was something that just was shocking me when I first heard it a few years ago. There's about 200 feral cats at Disneyland that come out at night to take care of the rodent problem. If you think about all the park visitors, they have about 44,000 visitors on average every single day. You got popcorn, you got churros, you got pretzels, you have all these things on the floor. They do have a rodent problem, but the feral cats make sure that Mickey and Minnie are the only mice there. When it first opened in 1955, the admission to Disneyland for an adult was $1. How much is it today? Anybody want to? The correct answer is too much. It is too much. So Disneyland, my sister actually works for Disney. I just want to say that in case there's a conflict of interest, but we're not necessarily that close. So, I want to now start talking about measles, and we'll get to Disneyland in a little bit. Measles is caused by the measles virus. It is a leading cause of death among children, especially among children that are unvaccinated or under-vaccinated. Measles is life-threatening. We're talking about a disease that has a vaccine available to us since 1963, and still we see globally a lot of deaths. In 1980, we saw some 2.6 million deaths. That's a lot. That's 2.6 million with an M. In 2014, not in the millions, but still significant, we had about 115,000 global deaths. So that is a significant public health concern. If you look at the numbers, it's around 314 deaths a day, 13 deaths an hour, and a majority, 95% of these deaths are actually in developing countries, which is also a concern. There is no treatment for measles. Our best preventative measure, of course, is the vaccine. When I was taking my medical micro, when I was taking my microbiology classes, my infectious disease classes, I was told this again and again, that measles is the most contagious infectious disease that we know. A second to pertussis. Measles and rubella, as I said, there's a vaccine associated with it, and yet we still have this major burden. In terms of what you see in the clinic, it begins like the flu. It is what we call influenza-like illness, at least for the first few days. A lot of respiratory diseases have the same type of symptoms. It begins with a fever, and this is usually presented 10 to 12 days after exposure. So individual may have the measles, be completely visually healthy, may feel healthy, but they are harboring the virus if they are infected. Symptoms begin after 2 weeks. And then these patients go into what we call a prodromal stage. And in this stage is where you start seeing the 3 C's, which is conjunctivitis, stuffy nose, which is coryza, and a cough. And it's during this phase, which only lasts a few days, where you start seeing what we call Koplik spots. And the Koplik spots appear at the back of the mouth, and there's a picture here, a little bit dated, 70s. But you see these whitish, reddish spots at the back of an infected person's mouth. Around day 19 now is when you start seeing the widespread rash. It spreads cephalocaudally, which means it begins in the face, and then it starts spreading to the trunk and the extremities. Measles, interestingly, it's transmissible right before you start seeing symptoms. So again, an individual might be seemingly healthy or appear healthy, but they still might be they still might be shedding the virus. They might be transmitting the disease or transmitting the virus. So this is what we call asymptomatic transmission, where 3 to 5 days before symptoms even begin to appear, you start shedding the virus. And 4 days into having that rash, you start developing, you also can shed the virus. What I'm showing you here is the reproductive number. When we talk about infectious diseases, there's this number associated with a lot of them. How many people can one person who's ill, who is sick, can transmit the disease to other healthy, susceptible individuals? For Ebola, it's 2. For HIV, it should be 4 there. SARS, severe acute respiratory syndrome, 4. For mumps, 10, and for measles, it's anywhere between, the CDC says, 14 to 18. So it is highly contagious. And so that's why it's such a public health concern when you see even 1 case. And on top of that, you have individuals that are unvaccinated. It just stirs, it should stir some public health concern. In terms of epidemiology of what you see around the world, this is just a global map that shows all the cases in the last 6 months, from November 2015 to April of this year. And the darker the color, the more cases. We have around the world most of the prevalent cases in Southeast Asia, as well as the African region. You have cases really all over the world. However, in the Americas, just recently, the WHO declared that it was measles-free, which means that we eliminated measles from the Americas at the end of September. Then why do we have so many cases? Most of the cases that we see in the United States, including what happened at Disneyland, and some of the cases that you see now in Arizona, are the result of importations, either domestic or international. What that means is that you have cases, you have these families going to Germany, the Philippines, or other places like that, where measles is not only endemic, but it's thriving, highly prevalent. They're coming back with the virus and they get sick here. those would be domestic cases or domestic importations. For international importations, you have people coming from other countries here, just coming to visit or coming to live here, and they bring with them measles. And again, consider that it takes around 2 weeks before you start seeing symptoms, so someone may potentially be on a plane seemingly well, but upon landing in the U.S. or any of the Americas, they start having symptoms and infecting other people. Recently, in 2016, England saw a significant number of cases at music festivals. I'll be honest, I've never been to a music festival myself, but at these music festivals in England, you have a lot of young people, anywhere between 15 and I guess 30-year-olds attending, a lot of them unvaccinated or undervaccinated, and they're seeing a lot of cases. In 2015, 2016, the CDC had several travel advisories to Nigeria, Sierra Leone, Germany, Ethiopia, Philippines, and we see this every year. A lot of these travel notices are still active. Some of them have been recalled. But measles is a big concern around the world. China reported 50,000 cases in 2015, Vietnam nearly 20, in 2014 the Philippines close to 60,000. It is a major public health concern when you start thinking about all of these cases around the world. In terms of risk, really the people that are at risk are people that are unvaccinated, especially unvaccinated children, unvaccinated pregnant women, anyone that potentially might be sick from something else, any non-immune person, and as I said, anyone really living in these areas that have a high prevalence of this disease. In terms of prevention, the best course would be the vaccine. That would be the best way to prevent getting measles in the first place, as well as in terms of public health, mass immunization campaigns. The story about what happened at Disneyland has to be addressed not only in light of the epidemiology, but also the MMR vaccine, which, as I said, has been available since 1963. It was not uncommon in the 40s and 50s to see in the United States cases in the hundreds of thousands, 600,000, 500,000 every single year. But as soon as the vaccine became available in 1963, it just plummeted. Within a few years, it plummeted the number of cases, just like the Haunted Mansion. Second dose was recommended in the early 90s, and then within a few decades, it was declared eliminated from the U.S., meaning that it wasn't no longer endemic, which was a big public health victory. The CDC recommends a 2-dose vaccine. A 2-dose schedule. The first one is given at 1 year of age, and the second is given when a child enters school, so around 4 or 5. There's this idea that MMR, or it was propagated that MMR was linked to autism, and that idea was promoted by this paper that was published in 1998 in The Lancet. Lancet is a very reputable journal. It's a strong journal. A lot of strong research is published there. But in this paper, Wakefield made the claim that having the MMR vaccine was linked to autism. If you've ever taken epidemiology, saying those words, something is causally associated, those are very strong words. And so what he said was that MMR was linked. It was causal. It was linked to autism. We have seen autistic cases rise over the last few decades. There's a number of reasons for that. One of those is that we've changed the definition for it, for what being autistic means. And at the same time, clinicians are just looking for it a little bit more. But Wakefield put this out. The media picked it up, parents picked it up, and everyone stopped giving the vaccine. And people were just afraid. People were afraid of giving this vaccine to their children because they would rather get measles than be autistic. But what ended up happening is that upon other researchers getting involved, other scientific professionals getting involved, they started investigating this claim and they couldn't duplicate it. And they were asking questions of Wakefield and his colleagues as to what exactly was going on in the study. And they found out that he actually had falsified his data. He was stripped of his license. He was considered a fraud. What ended up happening is that he was paid by a law firm that was suing pharmaceutical companies that were making this vaccine, and so there was a lot of money involved for Wakefield. Even today, Wakefield still holds to his claim, still says that MMR is linked to autism, but this idea is still prevalent today. But we have anti-vaxxers, and that term is something that was, I mean, we know what that term a little bit more now than we used to, but we have parents that refuse to vaccinate their children because of this, because they believe that exposing their children to this vaccine will cause their children to have autism. And there's some bad arguments for that side, for that argument there. One is that they may say there's no proof that vaccines don't cause autism. That is a negative statement, and it's very hard to prove something like that. It's hard to prove a negative, and so that is that's not true. There have been over 40 studies that have been listed by the American Academy of Pediatrics that have showed that there's no link between having the MMR vaccine and autism, or not just the MMR vaccine, but just vaccines in general. That one study in England, as I said, the Wakefield study, again, that was disproven. The Lancet actually retracted what they had published. A lot of the authors actually backpedaled and said they didn't want their name associated with it. There are lots of anecdotes about children developing autism after being vaccinated. Anecdotes are not proofs. And so that's not good. And again, there's just a amount of evidence that shows that there is no link between having the MMR vaccine and autism. It's nobody's business whether my children get vaccinated, and that is a strong claim that has been put out there. But we're all part of a herd. We're all part of this community, a population, whatever you want to call it. And so by not vaccinating kids, what you end up eventually doing is putting in danger someone else's child that potentially can get sick. Vaccines can overload a child's immune system. That's something that parents might also say. But the CDC, the Institute of Medicine, have all shown that there is a lot of evidence to show that a child's immune system is very hardy. The first few years of being born, a child is exposed to a lot of viruses, a lot of bacteria, a lot of pollutants, especially here in Los Angeles. And so a child's immune system is just very, very strong. Natural immunity is better than the immunity that comes from vaccination. In preparing for this for the seminar, I remember reading about measles parties, where people are bringing their children to get exposed to other kids that have measles, so they can get natural immunity. There's chickenpox parties. There's just a lot of these things going on. But is that true? Is natural immunity better than an immunity that comes from a vaccination? And the answer to that is no. The antibodies, the memory cells, your immune system doesn't recognize whether it's a natural infection or something that you get from a vaccine. And so it's not true that natural immunity is just better. But even in 2015, 2016, people are still having these measles parties. And as I said, on average, there's about 44,000 visitors to Disney every single day. It's a little bit more during the holiday season, but in 2015, according to some stats that I looked up, about 18.3 million visitors to Disney in 2015. In California Adventure, a little bit less popular, but still just as fun, about 9.4 million. However, what we saw a few years ago wasn't the first time that Disney and measles were in the same were mentioned in the same sentence. In 1982, we had a measles outbreak at Disney, where 14 cases were confirmed. We had in 2001 5 confirmed cases, and of course, just recently we had the outbreak. So let me just go through the timeline of what happened, and I was involved in this somewhat. At some point, there was an infected visitor that went to Disney between December 14th to December 20th. I actually visited Disneyland myself with my family on December 18th because my sister works for Disney. She works for their marketing production. Whenever you go to ArcLight or anything like that, she's responsible for the displays. She's already seen Doctor Strange. She gets a lot of perks. I had visited there, and during the holidays, you get more than 44,000 visitors to Disneyland. Sometimes it just feels a little bit more. On January 5th is when the California Department of Public Health was notified of a suspect measles case in an unvaccinated 11-year-old whose only notable trips were to Disneyland. Within a few hours, we were notified of more cases, some in Utah, for additional suspect cases from Orange County, and people were trying to, the epi officers were trying to figure out how they were all connected, because this was unusual. You started seeing outbreaks in Colorado. You started seeing cases in Colorado and Utah, even in Mexico. How were they connected? And upon investigation, it took one astute epi officer and just asked them, have you been to Disneyland? And they all said, yes, we have. And they all had visited Disneyland around that time. Within 2 days, 7 more cases were confirmed, and notifications were sent out to other states that we were on the cusp of a multi-state measles outbreak. By January 17th, so 10 days after we had notified other states, we had 51 cases: Utah, Colorado, Ventura, San Diego, San Bernardino, and Long Beach counties. The cases were just mounting up, and the news picked it up, and it was just in your face. It was high profile because it was Disney. And this is what it looked like. So the outbreak happened. So down here on the x-axis you have the time period, and then on the y-axis you have the number of cases. So at some point between December 15th and December 20th, you had an infected patient, our index case, going to Disneyland and just spreading the virus, shedding the virus everywhere. There's some talk that perhaps it was a super spreader, because what we know is that at least 44 people from Disney were a measles case. We started seeing cases, of course, the incubation time being 2 weeks. Within 2 weeks of that time, between around Christmas time, and everywhere you see blue here, it looks blue to you. It should be blue, but those are cases that had visited Disney. They were exposed at Disney at some point. And then these red bars here are the household contacts. You had now secondary contacts based on individuals that had been to Disney. So now you had just this circle of individuals getting infected, getting a little bit bigger. The ones in green here are the community infections, which is now individuals not related to each other, but being infected just by contact, whether going to the airport or the mall or post office, whatever. And then anything here in purple are unknown sources. We just don't know how they got infected, but they did. How do we know that all these cases are the same or come from the same outbreak? They all have the B3 genotype. So upon sequencing all of these cases, or majority of these cases, we found out that all of them were B3. B3 is a genotype. There's 23 different genotypes for measles, infected with any one of them. Globally, the epidemiology of these are just a little bit different, but B3 was from the Philippines. At least that's what we think. There's other places around the world where B3 genotype is present, but because at the end of 2014 there was such a big outbreak in the Philippines, and then you had coincidentally an outbreak in Disneyland, it just those puzzle pieces just fit. In terms of the investigation itself, there were 131 measles cases that were likely linked to this outbreak. We will never know the index case. Again, I was there December 18th. I couldn't tell you, I can't remember faces, I couldn't tell you if I saw anyone that was sick. And so at some point, this individual was just going from ride to ride, infecting other people. It could have been multiple individuals as well. 42 cases were directly linked to that initial exposure. 44 cases have some sort of unknown exposure. And as I said, all of them are the B3 genotype, which links it to the Philippines outbreak from a few months before this actually happened. Luckily, no deaths occurred. It would have been even worse if something like that had happened. And the Department of Public Health, the California Department of Public Health, considered this a significant investigation. We had, as of April 4th, 2015, we had some 2,200 cases that we followed up. That is a lot of man time, that's a lot of cost, that's a lot of work. And not all of them obviously were sick. We identified that exposure happened within hospital settings, clinical settings, schools, malls, airports, and of course in the home. The outbreak was declared officially over on April 17th. It had been 42 days or 2 incubation periods, 21 days, since we had seen a case. The greatest burden of measles was here in Southern California. We had cases in Alameda County, Contra Costa, LA County, Orange County. I mean, Disneyland is right there, had 35 cases, confirmed cases. Second was LA County, and then San Diego with 14 cases. But it was mostly in Southern California. About 88% of the outbreak happened here. And as I said, it was a significant investigation. In terms of whether these individuals were vaccinated or not, some were and some were not. 49 cases had some unknown or unverified status. How many of you are vaccinated against MMR? Recently, I got hired at the LA County Public Health Lab, and when they asked me if I was vaccinated, to be honest, I didn't know. I had to go and check my titers. And not knowing your vaccination status was actually one of the things that we saw, that a lot of people just did not know their vaccination status. Now, a little bit more, we have electronic records and things are just more online, and we're able to access that a little bit more. But back when I was growing up, we had these little yellow cards that I had maybe like 3 or 4 of those, and every single time I had to get all these vaccines. And again, a lot of these patients just did not know if they were vaccinated. Some of them did, whether they knew whether they were vaccinated or not. But what we did see among the cases, that majority of them were intentionally unvaccinated. They were just not protected. A majority of them were unvaccinated due to what we call personal beliefs. So I'll talk about this in a little bit, but upon going to a public or private school here in California, you have to show that you're vaccinated against 10 childhood diseases, and among them, measles. The only exemption that you can get today is through a personal medical exemption. Back in 2014, during this time, you had a personal belief exception that you could apply for, but I'll talk about it more in a little bit, but since this, it's no longer, you no longer can do it. Is there a question? Oh. One dose, the MMR vaccine is 92% effective at preventing measles. So upon getting the vaccination, it doesn't mean you're 100% completely free from ever getting measles, but you are plus 90% protected against measles. Getting the 2-dose vaccine, again, you get one at 1 year old and the other one right before you start kindergarten, it's around 97% effective. But can people that get vaccinated, or people that are vaccinated, can they still get measles? And the answer is yeah. If, let's say we say that there's 1,000 people that are exposed to measles, and 70 of them are unvaccinated. All right, we're over here. 70 of them are unvaccinated, and let's say that there's a 90% attack rate among those people that potentially could get sick. 90%, 73 times 90% would be 63 that are vaccinated, 63 that are sick. What about among the cases that have the vaccine? Again, it's only about 97% effective. And so let's say that 930 of them have received the MMR vaccine. Well, you're looking at 25 vaccinated cases that get measles. And so you still see, even among the vaccinated, that you have cases. So in the Disneyland outbreak, you still saw some cases, even among those individuals that had that were essentially just protected. The public health impacts, there's just 3 of them that I want to share with you. So as I said, in California, if you want to send your child to public or private school, you have to show that they're protected against these 10 childhood diseases. diphtheria, hepatitis B, HIV, measles, mumps, pertussis, rubella, polio, tetanus, and chickenpox. You have to show that. However, if parents filed a PBE, or personal belief exemption for whatever reason, then they were exempt from showing this. Or you could show a PME, which we do see there's some kids that just can't have a vaccine for other health reasons. PME, a personal medical exemption. But in February of 2015, state senators introduced SB 277, Senate Bill 277, which removed the PBE requirement, which means that no longer today, no longer can you show, no longer would PBE, or personal belief, be an exemption for not being vaccinated for children. So families had to vaccinate their children, unless there was some sort of course, medical reason for them not doing it. It was signed by law by Jerry Brown within 24 hours of it being on his desk, and it led to a lot of protests by anti-vaxxers, parents. Why can't the government tell me what to do with my child? But again, the idea is that we're all part of a herd. We're endangering children that are not our kids by not vaccinating our kids. In terms of vaccination coverage, what we saw, so these are all the counties where we saw cases. So again, you got Long Beach there, you had Alameda, you had, actually Long Beach is actually part of the LA data, Riverside, San Bernardino, San Diego, just all these different counties. And in the beginning of that school year, 2014, you'll notice that it's not, the vaccination coverage isn't that great. The lowest was 89% in LA, the public and private schools. That is embarrassingly low. You had 96% in other counties, 95%, 90% in Ventura County. No one above 95% or 96%. And yeah.
Is it effective July 1, 2016? Is that correct? So the academic year 15-16, it wouldn't have been required by then.
I have to double check that. It's either July or January.
Okay.
Yeah. It's a J, for sure.
I was just wondering if it was 16 or 15.
Yeah. So the vaccination coverage, again, was really low during that time, so it's not surprising that we saw cases in Orange County where we saw a lot of the cases. It was under what we consider our herd immunity threshold. So for the CDC, it's anywhere between 92 and 95% for measles. Herd immunity speaks to the idea that if 95 or between 92 and 95% of the population is vaccinated, then there's a good chance that those individuals that are not vaccinated, just by the environment, just by them being around people that are vaccinated, that they're free from getting the disease. So we saw just low numbers, and so it's not surprising that we saw those cases. After this Senate bill was introduced, which required parents to show that, we saw just an increase in vaccination coverage. Again, Disney, high profile. Everyone likes Disney. Everyone knows what Disney is. Everyone knows what happened at Disney in terms of measles. And so overall, we saw an increase of 2% in terms of the vaccination coverage, which was really good. The only exception to that was Yolo County, which I have no idea where that is in California.
North Sacramento.
It's just somewhere not here. And so we saw no change. We saw no change. But we saw a big change in Alameda County. If you look at the schools in particular, Alameda County, among all the counties, they had vaccination coverage in the 20s. It was not really, it wasn't high at all. They had 64% personal belief exception percentages. So this Senate bill actually has done a lot to, again, to try to achieve our herd immunity.
When I look at Marin at 85,
yeah.
And then is there any association between parents' beliefs about vaccines and socioeconomic status?
Well, actually,
wealthiest counties.
Actually, a lot of the personal belief exemptions are not in public schools, are actually in private schools. Yeah. And you do see a lot of cases more so among the wealthy. than you have among some of the lower economic groups.
Yeah, so there is a gradient.
Yeah, I don't know if there's been a study done on that, but yeah, that's what we do see. In terms of what we did in the lab, in terms of the lab work that we did a great job in responding to the outbreak. One of our state labs, the Viral and Rickettsial Disease Lab up north, did a lot of PCR testing. 17 local public health labs up and down the state did PCR testing as well. In LA County, we did not do PCR testing, we did serological testing. But the VRDL performed a majority of these PCR tests. Local public health labs did a lot of PCR tests as well. And as I said, the LA County lab, we did a lot of serological testing. We tested some 900 patient specimens. We sent out to the state around 120 something. And in terms of the genotyping that was done by the VRDL, they did see a majority of them being B3. But you also saw other genotypes, which would give evidence that there were potentially these other cases were not related. And it was a quick turnaround time. As soon as we identified a case, we obtained specimen and we tested it right away. So this led to a timely intervention, at least what we could do for some of these cases. In terms of the cost of what happened, in terms of the outbreak, we had, there's been studies done on the cost analysis of a measles outbreak done in California before. One was done in 2008 in San Diego, where a 7-year-old went with his family. He was unvaccinated, went with his family on vacation to Switzerland, and brought back with them the virus as well. 839 people were exposed, 11 additional cases, and it turned out to be a cost of $10,376 per case. That is a lot. The conclusion was that despite that there was high community vaccination coverage where this boy lived, that there were clusters of individuals and just within that social system of that family that had individuals that were unvaccinated or had poor vaccination coverage. Another more recent paper by Dr. Ortega-Sanchez that looked at 16 outbreaks in 2011 showed that there were just a lot of contacts that were investigated throughout that year. Some 17,000 among all of these outbreaks that happened in Indiana, in Kentucky, the San Diego one. And so what you see is just when you start looking at the numbers and how much one of these cases cost, one of these potential cases cost, not confirmed, it's around $298. And the cost to our local and state public health institutions were anywhere between $2.7 million and $5.3 million. So what I've done as part of one of my projects at the LA County Public Health Lab is to look at the cost of the measles outbreak at Disney. And so one of the ways we've tried to do that is by sending out surveys to our communicable disease controllers as well as to our labs, our public health labs. And so we asked them just a number of questions. We asked them about how many individuals were involved in the response. What was the personnel cost? How many hours were spent working on this? Was there any lessons learned? Were any projects delayed? Just important information to know as the measles outbreak took away from doing other things. In terms of the lab questions, we asked them what kinds of methods they used to test and confirm for measles. We asked them about any discordant testing, what was the cost of the testing. For our epi officers, our communicable disease controllers, we asked them about how many contacts were investigated. We asked them about if any cases were recommended for self-isolation and if any post-exposure prophylaxis was done on anyone. And now in terms of what we saw, again, what you have here is you have the cost. Here you have the different counties and the number of confirmed cases. Orange County, as I said, had the most number of cases, so 35 cases. And that's what the blue bars are. The orange bar is the number of how much it cost. This is using LA data. So consider that LA was used as a proxy when some of the survey results weren't complete. And so when you look at just the personnel hours, at how much we spent, it was close to $2.6 million just in personnel. That is just the epi investigation part of it, which means that per confirmed case, we spent around $10,000. And that is roughly around the same as what we saw in San Diego. When you start looking at how this measles outbreak compares to some of the others, if I still have to play with the numbers, so put an asterisk to over everything I say right now, it potentially could be the most expensive measles outbreak that we've had. When I still have to look at some of the other data as well, but this is just for the epi part of it. If you start including all of the cases, so remember the 2,200 cases that we actually investigated, the cost goes from $10,000, those numbers get bigger, to about $648. So it's still a little bit more than they would take a paper at $300 per contact. Looking ahead, one of the things globally that the WHO wants to do is to eliminate measles by 2020. And they're pushing for this hard, especially for places where measles is just, as I said, Southeast Asia, the African continent, where measles is just rampant. One of the things that we need, of course, is active surveillance. We need to make sure that we maintain high population immunity. Herd immunity is very, very important. We want to make sure that we are responding to outbreaks as they happen. So, of course, near real time, we want to educate parents to obviously vaccinate their children, and we want to do ongoing research to make sure maybe we can develop an even better vaccine. There is talk that potentially measles could be eradicated if we, push hard for this, because it fits all the criteria. We can do all the check marks. Humans are the only reservoir. We have a highly effective vaccine, and once you get immunity, it's usually long-lasting. And the vaccination, as I said, is very, very, it provides just long-lasting. So measles eradication is possible, but you have a generation of physicians and clinicians that have never seen a measles case in the United States. So that's another part of it, where you have pockets around the world where people don't know the devastating effects of measles. And so you have these parents having these measles parties, because they don't know. They've never seen it. They haven't lived through something like this. This study, another economic study that was done in 2011, said that if we were to push for measles eradication, it would cost some $7.8 billion. And that's only a little bit of money. So I'd like to thank Dr. Green, our director, Dr. Ziprick, Dr. Godwin, the VRDL, and all the feral cats that are at Disney. But thank you.